Ladies and gentlemen, dear colleagues, dear friends, this year we are marking 75th anniversary of United Nations, the time when our world is also struggling against the global COVID-19 pandemic, overwhelming health crisis with a severe economic and social impact. This pandemic has very clearly brought to light the strengths and weaknesses of health systems of every country in the world. Therefore, we may take collective actions to overcome the difficulties and build a better world for present and future generations. WHO is the leading UN agency in Turkmenistan for health, and since the beginning of the pandemic, World Health Organization is providing everyday support to the government of Turkmenistan and other national and international partners in preparedness and response to COVID-19. World Health Organization has been supporting Ministry of Health and other partners by working hard on strengthening infection prevention control, treating the diseases, improving laboratory capacities, opening the schools, and many other areas. WHO is first of all a health agency which is responsible for coordination, guidelines and norm setting in health, and therefore we are jointly working with the Ministry of Health on national guidelines, adopting recommendations which include comprehensive guidelines, for example, for the infection prevention control, use of the protective equipment by the healthcare workers, epidemiological surveillance, contact tracing, quarantine guidelines, food safety, home care, rehabilitation, and many others. Just to give you an example, that over past months, WHO and regional office and country office jointly with the Ministry of Health of Turkmenistan trained almost 200 doctors from the central and regional level on clinical treatment of COVID. Almost 200 medical specialists from central and regional level have been trained on epidemiological surveillance, infection prevention control, contact tracing, protective equipment, and other important issues. We also improved laboratory services and quality of testing. 37 laboratory specialists have been trained on practical aspects on laboratory surveillance for this virus. We also were in the field to better assess the situation in the country and work together to identify the best actions to prevent the spread of COVID-19. The main findings are available at the WHO webpage, and this recommendation first of all are that Turkmenistan should activate and is activating public health measures as if COVID-19 was circulating, scaling up the testing of acute respiratory infections and suspected cases. The health system in Turkmenistan is equipped to respond to COVID-19, but should be further strengthened in case of any rapid surge in cases, and the community should be fully engaged in all responses and efforts. Part of our support was bringing to Turkmenistan humanitarian cargo, which included thousands of medical masks, face shields, personal protective equipment, but also we equipped hospitals with oxygen concentrations and laboratory with a lab test for COVID-19. All of them were distributed in all countries, in all regions. WHO is committed to support the government of Turkmenistan in strengthening public health system preparedness and response. And dear friends, together with all UN agencies, World Health Organization remain ready to support Turkmenistan to further measures to protect the lives and livelihood of all people, including those who are the most vulnerable to the direct and indirect impacts of COVID-19. Wish you all the best and health. Thank you.